I think it's spreading widely because any sort of restriction on movement or any prevention or discouraging of mass gatherings was put in place really too late. So the pandemic was already out of control, and the lockdown, which has been in place in Maharashtra and in places like Delhi, have begun to sort of become effective only now. We're seeing a small downtick in the number of cases in these big cities, but our visibility into what's happening in rural India, particularly in states like UP, Uttar Pradesh, and Bihar, is extremely low because the testing levels are also quite low in these places. You can't prepare for a crisis in the middle of the crisis, and that's really what's going on. Either things should have been prepared for all through last year when, for the most part, a lockdown was in place. It is simply too late for many people. That said, there are efforts now to bring medical oxygen to people. Oxygen for India is one of the leading ones in that space, and there are efforts to try to see if we can augment the capacity in some states before the COVID wave reaches there. But all this is going to be quite late for many people. Some things are better. So India makes more PPE kits and masks and so forth. But certainly the medical oxygen situation is frankly is just frightening. The fact that people, as you saw in your news clip, that people are dying because of lack of access to an intervention that costs maybe €1 a day at most is really depressing, because this just should not be allowed to happen. We're not talking about high-level critical care capacity. We're just talking about the most basic of medical interventions, which is medical oxygen, which the lack of which is causing a large number of these deaths.